Your bones are changing right now, this very moment, but you won't notice it for months, maybe years. And by then, one simple fall could change everything. Most people believe that bone problems announce themselves with pain or sudden breaks. That's exactly what makes them so dangerous. Your bones can lose strength quietly, invisibly, while you're living your normal life, until the moment they can't hold up anymore. Think about your morning routine. You wake up, you stretch a little, maybe you feel a bit stiff, but that's just getting older, right? You reach for something on a high shelf the way you always have. You walk down the stairs the same way. You gardened all weekend or played with your grandkids. Nothing felt wrong in that moment. But deep inside, something important might be happening to your skeletal system that you're completely unaware of. What we're going to explore together is how bones gradually weaken in ways you can't see or feel, and what the actual warning signs are that show something is changing. I'm going to explain this simply, without medical jargon, because your health is too important for confusion. By the end of this conversation, you'll understand exactly what's happening inside your bones. You'll recognize the subtle signs your body is already sending you, and you'll know 3 clear, practical things you can start doing right now to protect yourself. You'll feel more in control and less uncertain. Let me start with something important. Your bones aren't static. They're not like the skeleton model you might have seen in a doctor's office, just fixed pieces that stay the same forever. Your bones are actually living tissue. They're constantly breaking down and rebuilding themselves. It's a beautiful natural process, like your skin shedding and renewing, except it happens inside. Throughout your life, your body has maintained a careful balance. Old bone breaks down, new bone builds up, and the net result is strong, healthy skeletal structure. But here's what changes, particularly for people in their 60s, 70s, and beyond. That balance starts to shift. Your body becomes slightly less efficient at building new bone, while continuing to break down old bone at the same rate, or sometimes faster. This shift is related to changes in hormones, particularly in estrogen and testosterone, both of which help maintain bone strength. It's also connected to how your body absorbs calcium and vitamin D, which are essential building materials for bone. Over time, bone density, that's essentially how tightly packed and strong your bone material is, gradually decreases. And here's the crucial part. This happens silently. There's no pain signal, no alarm bell going off. Think of it like a sponge slowly drying out. A new sponge is dense and full, with lots of water holding everything together. As it dries, the structure becomes more porous, more fragile. But the sponge doesn't hurt while this is happening. You only notice when you try to use it and find it falls apart easier than it used to. The good news, and I want you to hear this clearly, is that this process is slow. It doesn't happen overnight. You have time, and understanding it means you have options. Now, the behaviors and circumstances that accelerate this natural bone loss are often invisible, which is why I wanted to focus on them today. Several things can speed up bone thinning without you realizing it's happening. First, there's something called sedentary life. When you're not moving much, when you're sitting for long hours, whether that's watching television, working at a desk, or driving, your bones don't get the signals they need to stay strong. Bones respond to weight and movement. When you use your body, your muscles pull on your bones, and that stimulation tells your bones to stay dense and resilient. When you're mostly still, your bones get the opposite message. You're not needed much, so let's use that calcium for something else. Many seniors find themselves moving less as they age, sometimes due to minor injuries, sometimes due to arthritis, sometimes simply from habit. And this reduced movement creates a hidden cost. Second, there's diet quality. Not eating enough protein is a major one that people don't often connect to bone health. Your bones aren't just made of minerals. They have a structural foundation made of protein. If you're not consuming enough protein, your body can't build or repair bone tissue properly, even if you're getting adequate calcium. I've seen people taking expensive calcium supplements while not eating enough chicken, fish, eggs, or dairy. It's like trying to build a house with plenty of bricks but not enough mortar. Caffeine in large amounts can also affect calcium absorption, as can very high salt intake. These aren't reasons to eliminate caffeine or worry about normal salt use, but excessive amounts do matter. If you're drinking 5 or 6 cups of coffee daily and not eating enough calcium-rich foods, that's a combination that works against your bones. Third, certain medications have an effect on bone density that people rarely discuss with their doctors. Some blood pressure medications, some asthma treatments, and certain other prescription drugs can influence how your body maintains bone. This isn't a reason to stop taking necessary medications. Your doctor prescribed them for important reasons. But it is a reason to have a conversation with your doctor about whether your bone health needs extra support if you're taking certain medications long-term. Fourth, and this one affects more seniors than you might think, is low vitamin D. Vitamin D is essential for calcium absorption. Without adequate vitamin D, your body can't use the calcium you're consuming. Many people, particularly in northern climates or those who spend most time indoors, become deficient in vitamin D without knowing it. There's no symptom that screams vitamin D deficiency the way a broken bone screams pain. Let me pause here because I want to check something with you. How many of these behaviors have you noticed in your own life? Are you moving less than you were 5 years ago? Is your diet what it was before? These aren't questions to feel guilty about. They're questions to help you understand where you actually stand right now. Now, here's what's really important. There are actual signs your body is sending you. The problem is that most people don't recognize them, or they dismiss them as just part of getting older. One of the most overlooked signs is gradual height loss. Many people lose a 1/4 inch to a 1/2 inch in height every decade after age 40. If you've lost an inch or more in height since you were 30, that's potentially a sign that your spinal bones are compressing. Not dramatically, but consistently. Your spinal vertebrae might be losing density and beginning to collapse slightly. This is different from normal aging posture changes. Another sign is what I call the sudden fragility moment. You bump your shin on a chair, or you fall from a step, or you catch yourself awkwardly, something minor that wouldn't have injured you 10 years ago, and you get a significant bruise, or worse, a fracture. Or perhaps you reach for something and suddenly feel a sharp, localized pain in your back that takes weeks to fade. These experiences suggest your bones might not have the shock-absorbing capacity they once had. Receding gums are also connected. The bones in your jaw are similar to other bones in your body, and they can be affected by the same density changes. If your dentist has mentioned that your gums are receding or your teeth feel slightly looser, that's information worth connecting to your overall skeletal health. Persistent lower back discomfort. Not dramatic pain, but a constant, dull ache that makes certain movements uncomfortable can indicate that the vertebrae and supporting structures are under stress from reduced bone density. And one more. If you've noticed that you're more easily fatigued, or your recovery from minor bumps and injuries has slowed down significantly, that's worth considering. Bone is living tissue, and when it's struggling, your whole body feels the ripple effects. Have you experienced any of these? And more importantly, have you ever connected them to your bone health? Most people haven't because doctors don't always connect these dots either, unless you specifically ask. So what's actually happening inside when your bones are losing density without you feeling it? Let me paint the picture clearly. Your bones have an outer layer called cortical bone. That's the dense, hard part you think of when you picture a skeleton. Inside that is trabecular bone, which has a more sponge-like structure with spaces throughout. Those spaces allow your bones to be strong, but not heavy. They also contain bone marrow, which makes blood cells. When bone density decreases, what's actually happening is that those spaces inside the trabecular bone are enlarging, becoming more like gaps. The structure becomes less efficient at supporting weight. Imagine comparing a brick wall that's tightly packed versus one with gaps and spaces. The tight wall supports more weight and stands stronger. The one with gaps is still a wall, and you might not notice the difference by looking at it, but drop something on it or lean on it hard, and it fails where the sparse wall would have failed. The reason this happens without pain is anatomically straightforward. Bone tissue itself doesn't have pain fibers throughout it the way skin or muscles do. There are pain fibers around bones, and in the periosteum, that's the membrane surrounding bone. But the interior of the bone itself doesn't send pain signals just because it's becoming less dense. You only feel pain when something actually breaks or when the membrane gets inflamed or irritated. This is different from osteoporosis, a diagnosis where bone density has dropped significantly enough that fracture risk is substantially elevated. But the changes we're discussing today can precede an osteoporosis diagnosis by years. You can be in the process of bone loss right now without any diagnosis, without any test showing it, without any symptom alerting you. And here's what many people don't realize. A standard bone density test, called a DEXA scan, is quick, painless, and easy. It uses a tiny amount of radiation, far less than a chest X-ray, and it gives you actual numbers about your bone density. If you're over 50, or if you're over 40 with risk factors, getting a baseline bone density test is genuinely one of the smartest preventive steps you can take. But here's what I want you to focus on right now. Knowing this, understanding it, puts you in a position of power. You're not a victim of invisible bone loss anymore. You're someone who understands what's happening and can take action. Before we move forward, I'd genuinely like to hear from you. In the comments, tell me, have you ever had your bone density tested? Or what's one behavior from what we discussed that you've noticed in your own life? Your comments help me understand what you're experiencing, and they help other viewers realize they're not alone in this. Now, before I wrap up, I want to be clear about something. What we've discussed today is educational information meant to help you understand bone health better. It's not a diagnosis, and it's not medical advice specific to your individual situation. Everyone's health is unique. If you're concerned about your bones, if you've had fractures, if you've noticed height loss, or if bone health runs in your family, absolutely have a conversation with your doctor. They can assess your individual risk factors and decide whether bone density testing is appropriate for you and what specific steps you should take. You've spent decades building the body you have. Your bones have supported you through every moment of your life. They deserve your attention and care now, not because you're afraid of what might happen, but because taking care of them is how you stay independent, active, and able to do the things that matter to you. That's worth the effort. Thank you for taking this time to understand your health better. I'll see you in the next one.